Good afternoon. I'm Weston Clark, Director of Community Outreach for Salt Lake City. We're really glad to have you join us as we discuss the challenges of unsheltered homelessness. It is a difficult and emotional issue that requires time, resources, and thoughtful community-based solutions. As a city, we are committed to helping our unsheltered community access the resources they need so that homelessness becomes rare, brief, and non-recurring. We've gathered a great panel of experts here to help us understand the issues, and we look forward to hearing your questions. First, we have Michelle Hoon, who runs Salt Lake City's Homeless Engagement and Response Team. We also have Amanda Christensen of Volunteers of America, who is in charge of the Homeless Outreach Program. Blake Thomas, the Director of Salt Lake City's Department of Community and Neighborhoods. And finally, we have Dale Keller, Manager of the Environmental Health Bureau at the Salt Lake County Health Department. Thanks everybody for being here today. Let's go ahead and jump into some questions now. Let's start with Michelle. Michelle, what exactly is the city's role in homelessness?
Thanks, Weston. Thanks for hosting this today. We're excited to get to talk about this subject. So the city acts as both a funder of programs for people experiencing homelessness and as a convener of partners to problem solve better ways to serve vulnerable populations and to help keep our neighborhoods safe and healthy. The only direct service that the city actually provides to people experiencing homelessness is street outreach that is provided by the Community Connection Center. What the Community Connection Center is it is the social work co-responder model that is within the Salt Lake Police Department. Other than that program, the city, what the city really does is we take in money from taxes and awards from other government entities like the state or the federal government. And we turn those around as awards to professional service providers who then deliver direct services to people experiencing homelessness.
Hello, Orion Goff here. How you doing?
So things like street outreach, shelter, case
dream,
management, and things like that.
Thanks, Michelle. Speaking of money, Blake, this question's for you. Salt Lake City, as far as I understand, spends about $15 million a year on homeless services. Where do those dollars come from and where specifically do they go?
Thanks for the question, Weston. The $15 million that you cited, that includes grants to service providers in the community. It also captures investments in our homeless engagement and response team, or HEART as they'll be referred to, which Michelle, as you mentioned, is the manager of. Emergency response, and then also neighborhood cleanup. So a little history on some of this funding. In January of 2020, the first month of Mayor Mendenhall's term, Salt Lake City, the mayor and the council stepped up to fund a city-owned location and organized the startup of an emergency winter overflow shelter in partnership with Salt Lake County and homeless service providers. If you recall, recently in December of 2020, a month ago, we again were willing to host a winter overflow location in our city after other jurisdictions declined. So the city is proud to do this work, but it's important to note that this is a statewide humanitarian crisis and we need every level of government to do their part. Lastly, as it relates to some of the funding that goes towards homelessness or the prevention thereof, is over the past 5 years, the city has invested more than $65 million into affordable housing, which is more than any other jurisdiction in the state, including the state of Utah. So that's something that we're proud of and hope that our budget shows our values and commitment.
Excellent. Thanks, Blake. One of the questions that we hear all the time, and this question's probably to you, Michelle, we hear that there are not enough shelter beds. Is that true? And where are people supposed to go if there are not?
I'm happy to answer that question. It's a complicated answer. I will say the answer to that question really can be both yes and no on the same day. So I'm happy to walk everybody through kind of some of what this looks like. There are 700 beds that are available to adults in our homeless resource centers. There are, outside of that, or I think including that, about 1,800 beds that are actually available throughout the county in different sheltering programs. So when you're talking about that many beds and that many individuals, what you're talking about is turnover. You're probably going to have a lot of turnover that happens within a day within that system. To help us keep track of that churn on a system level, we get a snapshot head count every day that happens around 2 a.m. the night before. And that helps us to figure out what general bed capacity is actually looking like. We are launching a live database, or sorry, a live dashboard today that helps us keep track of shelter bed utilization and helps to kind of demystify some of the questions around shelter utilization and how full some of those resources are for people. Shelter bed utilization is actually pretty similar to ICU utilization, which is interesting in that counts aren't always static. People are going to leave, new people are going to come in. So there's really an effectively full rate at the shelters that is actually lower than about 100%. We don't have this down to a science in the same way that they do with hospitals just yet. So we're not completely sure what that effectively full rate is going to be, and it's probably going to vary from program to program. This is still our HRC system is still a pretty new system for our community, and there are things that we need to work out about it. It's generally looking like the effectively full rate is probably somewhere around 95%, but as I said, we're still definitely learning with this. There are also different types of beds that people are allowed into at different times during the day. So we have case managed beds, we have referral beds, we have night by night beds, and all of those offer varying degrees of long-term stability at intake. How this relates to unsheltered folks is that, and encampment specifically, is that there's probably never going to be a time where we can pick up one entire camp and move everybody from that camp into a shelter in one day. Even if we did try to do that, the likelihood that all of those people would want to do that is kind of slim. That being said, by better understanding what bed turnover looks like and having lots of different kinds of options available for people, we can chip away at some of our larger encampments, and we can completely resolve some smaller ones, often just through services alone, which is really great to see, and that's what you want to see. Outreach is a really key component to filling those shelter beds that might come open. We understand, though, that this can be really tough. So we try to work as closely with our professional outreach partners as we can, so that we can be really careful about abating camps or closing camps. So for example, if VOA is working with someone who's camping and that person just needs a couple more days before they can get into a shelter or housing program, then the city and the county health department really want to work with that person to kind of keep them where they are until that placement can be made. We want this to be a very person-centered and really focused approach. We're lucky in Salt Lake in that we do have a problem with unsheltered homelessness, but it's not to the degree that it is in other cities where you really can't have that like person by person sort of evaluation. And that's something that we really try to focus on as we're trying to figure out what we do with different encampments.
Great, thank you. And speaking of outreach, we've got the expert here with us today. Amanda, if you could give us a little insight into your work, what does outreach look like and why is it so important to do?
Thanks, Weston. So just a little bit about what outreach looks like. So our team specifically engages with individuals out in the community. So we go to where they are. What we do is we go connect and start kind of the process of communicating with and building rapport with individuals who are currently experiencing unsheltered homelessness. So that may be going out to some of the encampments or different areas where unsheltered individuals may be. What a day could look like really varies. It's a pretty dynamic job and position as the individuals who we work with and the work that we do, it's really not the same from day to day, but I can give you a little bit of a snapshot of what that kind of looks like. And that looks like there's a couple different ways which we may be contacted. So one may be a client may directly contact us. So call us or text us and ask for specific assistance with something. And then we may go out and engage the client in the community wherever they're at. Another way is we have community partners, neighbors, the public in general gives us a call and contacts us and lets us know about areas where there may be someone who's in need, and then we would respond that way. And additionally, we also work closely with the city and other government entities on areas where they find individuals who may be needing assistance and would respond to those areas as well to engage folks. And then really lastly is we actually, as we're out in the community engaging folks, we're finding new areas and new individuals in need all the time. And so what it may look like is we get a call, we go out, the team goes to engage a certain encampment. When we're in that encampment, we would be then communicating with those individuals in need of assistance, figuring out what their needs are and how best to refer them. So our team really relies heavily on the homeless services system and really all of the systems that our clients use, such as the local government system as well, mental health providers, substance use providers, all of that. So we would connect with the client and then try to connect that client to that resource. It may be a bed in a resource center, it may be working directly on housing. And then while we're in that encampment, we may locate someone who we've been looking for some time, who we've lost tabs on. And we may be contacting their housing case manager to have them finish housing paperwork, or taking another client to go, take them to the DLD to get their ID, or help another individual by just getting some basic needs items. It's really dynamic day to day. And what makes it so valuable is that we really are going out and assessing the clients and meeting their needs where they are, going out into the community and meeting them where they are, and helping them navigate the homeless service system and some of the other systems that they may struggle to navigate on their own or not know how to navigate, as well as some individuals may not have access to the system, or have some reluctance to access the system, and we can help do those warm handoffs and help them navigate it in a way that maybe they're more comfortable.
Sort of a follow-up question to that. You mentioned the reluctanceness that some might have in engaging with services. What are some of the reasons that someone might not accept these services or go into shelter when that's offered to them?
Yeah, so that's kind of a complex question because no one client's the same, right? So everybody's an individual and kind of has their own personal experiences. And I try not to generalize when looking at some of the reasons that we've heard from folks. Really, the specific option that they need or they're comfortable with may not be available. So when saying that, it may be maybe they've had a negative experience in a congregate site and that doesn't work for them. And so they may be looking for an additional option that may take them outside of a congregate site. And so the option just simply may not be available at that time to them. Other pieces are people who are coupling. So looking at specific options for individuals to enter as a couple, that has and can be a barrier depending on availability. Potentially undertreated or untreated mental illness or substance use can be a contributing factor as well to them maybe not feeling comfortable inside a shelter setting or around people that they don't know. We know a lot of our clients have a history of trauma, and when you're working with individuals with trauma, safety is a huge piece of that. And so making sure that their environment, they feel safe in their environment is one of those pieces to why someone may not access a traditional kind of shelter resource. And maybe that's a client that we look to go directly into look at the direct housing options instead of shelter options. So we're constantly kind of assessing what the needs are and what the best fit for that client is.
Great. Thank you, Amanda. I know that one of the most visual aspects of homelessness in the city is the camping and the encampments. And it's a big topic. It's something we hear a lot about in the city. Associated with that are camp abatements. Dale, I wonder if you could help us out a little bit here and tell us what a camp abatement is and what you at the health department, the county health department, does with them.
Yeah, good afternoon, Weston, and thank you very much for the question. The first part of that is quite easy, and it's basically what you said. It's a camp abatement using many partnerships, collaborative effort, many of those on this call to address the encampments. This is done under the authority granted the health department through Title 26A by the state legislature, as well as regulation number 7 in the Board of Health regulation. So that's kind of the easy part. The why we do it, there's all kinds of variables based on that. It's important to understand that the health department, specifically environmental health's involvement in this, is really only focused on 2 variables: the public health component of encampments, the negative public health component, and the environmental health component. We certainly understand that there are many, many other variables: addiction issues, mental health, lack of housing, other issues. And so the public health issue, let's specifically talk under the environment we have now with COVID. When we have these large camps, congregate setting, there are a number of concerns that we have with the camps. Tents really, really close together. That's a problem with COVID. Lack of people wearing masks. Virtually nobody at these larger camps wear masks. Lack of hand washing, or even the ability to do hand washing, is certainly a problem and a public health issue. Other issues that we generally see: solid waste accumulations. We recently partnered with the city and did a cleanup on Main Street and 700 South. Over 50 tons of refuse was removed at that location. Lack of potable water, lack of food refrigeration. All of these are just terrible public health issues that lead to disease and other compelling concerns. Also, and I would argue maybe the biggest public health issue is the lack of human waste containment, which unfortunately we tend to see at all the large encampments. The other arm of the health department's involvement in this is the environmental health piece. And camps tend to be in the more environmentally sensitive locations in the valley. The health department has identified almost 100 camps between Salt Lake City and West Jordan along the Jordan River corridor. And so there's a number of negative environmental health pieces to that. Obviously, the solid waste accumulation, the infectious waste, cutting down of trees, not only along the Jordan River, but other camps, the illicit encampments, particularly during, it has a negative effect on air quality, but also has other problems when you have uncontained fires. And then we've really identified a very, very unique concern, and that is, I used to be an inspector in Salt Lake City many, many years ago, and we never saw rats in Central City unless when we're talking along the Jordan River. The Norwegian rat tended to be in the foothills, at least east of 700 East. Now we're seeing rats every time we do an abatement. When we did the recent 700 South 2nd East, several dozen Norwegian rats were running around. And we just haven't seen that before. And rats are a real concern for the health department because they're a vector for, 30 plus zoonotic diseases. And it's something that we really try to keep a handle on. And then probably the last environmental health issue is we keep track of the water quality of water bodies, including the Jordan River. And we have seen a huge spike in total coliform in the Jordan River, which is a direct result of feces being introduced into the river. So a number of compelling public health issues, and we try to focus our response and our abatement to those issues. Thank you.
Sorry, I've just had a little internet trouble. I'm not sure if you're able to hear me at this point. Give me a thumbs up if you can hear me at this point. All right, sorry about that. Thank you, Dale. I heard most of what you said. I appreciate that. Um, let me move to actually a follow-up question, Dale, and potentially for the rest of the group, if anyone else wants to respond to this. With the abatements and the encampment cleanups, we hear a lot about people losing their belongings. We're talking about a population who doesn't have a lot to begin with, and there's a lot of concern around their stuff being lost when a camp is being broken up. Dale, does the health department throw their stuff away?
Thank you. Good question, and something we hear all of the time. And last thing the health department wants to do is make a difficult life worse for our unsheltered friends in the community. With that being said, before we do any abatement, we always post the encampments with a notice that has been approved by the district attorney's office. We're not legally required to do that, but we believe it's the right thing. It's an internal protocol. We attempt to do that at least 24 hours before an abatement. And the truth is, the speed of the abatement is almost associated with how many people have not done anything relative to getting ready to move on. Folks almost always know that abatement is happening because of the outreach that Amanda articulated. Even then, if somebody is still there, they haven't adhered to the abatement, we'll give them a reasonable amount of time, an hour, we'll give them bags, assist. It's also very common for us to stage material. Recently on the Main Street 700 South cleanup, social workers asked on 5 or 6 different encampments if we would please stage material, which we did. We collected, and in 2 cases there were lots of syringes, and it was somewhat of a safety issue for health department and abatement staff, and we staged that and then attempted to reunite it with the owners. So throwing away stuff is kind of a compelling question because mostly folks take belongings that they have, but with a little bit of a hoarding mentality, and others, some things maybe are disposed of that are left behind that might be of some value, but sorting through that is extremely difficult. But throwing an individual stuff away is certainly something the health department does not want to do.
Thanks, Dale. Does anyone else have anything to add to that?
Yeah, Weston, if I could jump in. One thing that we provide at the city is a free storage program for people who experience homelessness. It's called Place for Your Stuff, and it's located in the Rio Grande area. It's about 5th West and about 3rd South. And what that is it is a storage program that people can access ahead of abatements if they would like to. And they can put their belongings in there that they either don't want to carry with them or can't carry with them. They can take those things to a place for your stuff to store if they want to go to shelter, and there are things that they can't take to shelter. The only things that aren't able to be stored there are perishable food items, weapons, and illegal substances. Those are the only things that they won't take. It is a 90-gallon storage bin that people are able to get, and those are re-upped on 90-day cycles. So the person does have to call in fairly frequently to just check up with that provider and let them know that they would still like to keep those belongings stored. Sometimes what ends up happening is people will store their stuff and then they move on to a completely new location and they forget that stuff is there. And so we want to make sure that that people have the chance to re-up that storage option. But that is there, and that's something that can be really, really helpful for people in this instance.
Weston, this is Dale again, and if I might also add that a component of the abatement is an offer to provide transportation of the belongings that Michelle articulated to a storage location, just with a pickup truck, and we're glad to do that. And also another component of the abatement is to have on-hand transportation to access resource centers. Generally, that would be transportation to the Wiegand Center. So again, I'll reiterate, throwing belongings away is the last thing the health department wants to do as a part of these abatements.
Thanks, Dale. Thanks, Michelle. Speaking of abatements, we've kind of talked a little bit about this, but I don't know if there's any more. There's a lot of entities involved here in these processes, and I'm curious as to what the different roles are. Like, what role does the city play in abatement? And maybe, Dale, there's more you could add to what the health department's role is. You've kind of addressed a little bit of it. And even Amanda, does VOA have a role in an abatement process? Michelle, why don't we start with you?
Sure. So the Homeless Engagement and Response Team, that's my team. We bring together different city departments and outreach partners to help us determine what interventions might be necessary to resolve different encampments that develop within the city limits. So this is something that the city has actually done for quite some time, but it is kind of taken on a new life with our community commitment program this year. What we've been able to do as a result of the community commitment program is to bring on more partners and to more closely collaborate with our professional outreach teams before any camp abatement or camp closure. What we do is we get together in a big meeting and we talk through people who are staying in different camps, what's been tried already, maybe as far as outreach or enforcement has goes. And then if it's possible, we feel to resolve the camp through service support only. If that hasn't worked out, then we work with the county health department to plan an abatement to mitigate any environmental health risks that might come up as a result of that camp. We also work with the police department to see if there are any steps that need to be taken to reduce crime or victimization or other things that could be occurring within that neighborhood as a result of that camp. So that's mainly what the city does as far as abatements are concerned.
Thanks, Michelle. Amanda or Dale, did you want to add to that?
Yeah, this is Dale. And I would let you know that we've been addressing encampments for probably 2 decades now in the health department. It's only been until the last 4 or 5 years that we really partnered with the wonderful folks at VOA and other agencies. And I can't imagine not doing this without the social service outreach that we apply with every abatement. It's probably a little more healthy of a partnership in Salt Lake City than it is in other municipalities because there's obviously encampment problems in other cities. But the bottom line is the primary regulatory piece that the health department has is indeed that, the authority in Title 26A, the legal piece to this.
Thanks, Dale. Amanda?
Yeah, so just kind of what Michelle and Dale have already said a little bit, but so our role really is to go in prior to any abatement happening and engage these encampments. So as soon as we know that there are unsheltered individuals in an area, we would go and engage those individuals, trying to get them connected with services. And then additionally, we really use that meeting to indicate potential alternatives or options, and also advocate at that time for things maybe like a delay so that we can specifically connect a little bit longer, or if it's an option to continue to engage the encampment a little bit longer and just have some cleanup services, or if the abatement needs to occur. We've worked closely with Dell and the health department on things like connecting individuals to services, but holding off maybe on a couple of the encampments, and so that we can get those folks connected and then get them their stuff a little bit later. And the health department has helped in those cases as well. So it gives us an opportunity to advocate for those experiencing unsheltered homelessness, and also to really do that front end outreach beforehand, not only to just let clients know that it's kind of happening and put it on folks' radar, but also to really try to push for that connection to service. We do obviously really focus. I mean, we're a client-centered program and agency in general, and respect the client's choice. And so we obviously are going to connect and give them, all the information that they need to make their own decision, but also be available as the resource to connect them and do those warm handoffs and transport and all of that if they decide to enter service.
Awesome. Thank you, Amanda. Such a critical role in the process. Appreciate it. Michelle, we also get this question a lot. Why isn't there just a place for folks to camp in the city?
That is a good question, and the answer is long. Just warning you in advance, so buckle up. I think that kind of a common misconception that we can all have is that people are camping because that's how they want to live, and that's not typically the case. One thing that we know that we see from research on different encampments that research that comes from different areas, what we hear from outreach workers here, is that people tend to form encampments largely because they're looking for some kind of degree of privacy and autonomy that they don't feel like they could get in a shelter, or at least in the shelter options that might be available to them right at that time. The same thing tends to happen with managed encampments. Managed encampments do tend to come with rules, and they come with codes and things like that that people maybe can't or don't want to follow. And that leads them either to separating from the group on their own and forming their own encampment in another spot, or being asked to leave like a managed encampment site. Unmanaged encampments, when they're small, they actually can usually self-police and stay relatively safe. And they can actually manage to be pretty good neighbors, we find. But particularly in urban environments, when they start to grow is when you start to see a lot of just concerning behavior surrounding them. So things like victimization, things like property crime, other things that can hurt both the campers and the neighborhood that surrounds the camp. There's also just kind of thinking about sort of how the system works. There's always only so much money that can be spent on shelter in a given year. So when we talk about trying to find places for people to go, we're always kind of talking about a trade-off in what governments and service providers think is the right thing to invest our community resources in. So the question that governments and service providers have to ask themselves in situations with limited resources is what is going to best serve the greatest number of people in this situation that we're in. And then we all come together, we try to come to a consensus on that stuff, and we put our money towards developing programs based on what that consensus is. A lot of people tend to think that answering the question of what is going to be best for people experiencing homelessness within the city is the responsibility of the city government, which it actually isn't. That responsibility is given to an entity called a local homeless coordinating committee. And the local homeless coordinating committee in Salt Lake is called the Salt Lake Valley Coalition to End Homelessness. The city is a very active partner in the Salt Lake Valley Coalition to End Homelessness, along with service providers and community advocacy groups and things like that. It's an open group that anybody who's interested in this subject can join and can make their voice heard in. So this year, when the Salt Lake Valley Coalition to End Homelessness got together to put together a winter overflow plan, the coalition actually did consider managed encampments as an option for winter overflow and decided against that in favor of developing non-congregate overflow shelter programs instead. This is really specific to COVID-19. The pandemic has definitely changed a lot of our crisis response system. I think in some ways we've learned a lot of good lessons, but in some ways it's presented some new challenges too. The reason that we decided against this as a coalition is largely because managed encampments really cost about as much as it does to put together an indoor shelter program. So there isn't really a cost savings to the community if that's what you're looking for. Also, as mentioned above, they can be a good tool for ending people's homelessness, but they tend not to really solve the problem of on-street camping. And so that is why instead the Salt Lake Valley Coalition to End Homelessness chose to focus on developing non-congregate options for people to come inside to try to isolate, try to mitigate the spread of the virus as much as possible while also providing indoor shelter.
Great, thanks, Michelle. You mentioned COVID-19 and its impact on this, and I wonder, Dale, if you could chime in and speak to the CDC guidelines about encampments, because we do hear sometimes, people saying that abating, or the CDC saying that abating camps shouldn't happen right now because of COVID-19, but we're still doing it. Can you speak to that issue?
Yes, I can. Thank you, Weston. And trust me, that's not the first time that I've had that question asked of me here the last couple of months. A couple of important things to keep in mind. The CDC document addressing encampments specifically calls these considerations and occasionally calls them guidelines. What we're enforcing are laws and regulations, and clearly the laws and regulations have primacy over guidelines or considerations. That's kind of the easy answer. The more difficult variables to address here is that CDC is very, very focused and specific on what they're addressing, and that is the lack of spread of COVID. There are many, many other public health deficiency issues that I've articulated earlier, public health and environmental health associated with illegal encampments, and the CDC guidelines are not taking any of those into consideration. But we certainly don't ignore those guidelines. They're very important to us, and CDC is an important partner to the health department. And in the same document that articulates suggesting against breaking up camps, it basically has 5 pillars of addressing encampment problems during COVID. Those are isolation of sick people, almost from day one of the COVID problem, and I was a part of this. We've set up isolation facilities for those that are sick, quarantine facilities. Since February of 2020, we've set up those too as a recommendation of CDC. A place for a vulnerable population to be able to house safely, and that would be folks elderly with a compelling public health issue or health issues that they could safely stay. We've been doing that now for a better part or nearly a year. The fourth is Overflow Shelters, and as Michelle had stated, there are 2 of those that have been set up, and so we've really done a lot to address CDC's guidelines during COVID and addressing our unsheltered population problem. And then the truth is that we have literally hundreds of camps that we know about that are small camps that we haven't addressed, and part of that is because of the CDC guidelines. Where we will take action is when a camp becomes a bit of a problem relative to size, to garbage, to the other variables that I articulated earlier. And with those, in my mind, the community health, the public health issues certainly outweigh the variables that maybe the negative impact on COVID if one were to break those up. And then the honest truth is, if you go to these large camps, garbage is always a problem. Virtually nobody is wearing masks, lack of hand washing, and all of those variables are a real concern if one just looks at this issue in the context of COVID. Thank you.
Thanks, Dale. Are there, you've kind of already addressed this, but I just want to make sure that we did. Are there other health concerns in these large encampments outside of COVID that particularly pop up?
Yeah. Thank you. And I think I pretty much touched on that. But in the last 3 or 4 years, I can think of 2 encampments. I'll even give you a location. One along the Jordan River between about 3,500 south to about 42nd south, where we removed 1.2 million pounds of garbage off of the Jordan River. And it's interesting that this is an area that has been set aside as a kind of a pseudo wetland, environmentally sensitive area by the Corps of Engineers. And so when we approached them to get equipment in to clean up the garbage and the trash, which was stunning, we were denied that opportunity because they didn't want us to disturb the environmentally sensitive areas. So we actually had people fly in out of Denver, had a walkabout in these, and basically they were walking through what one could articulate as a landfill, and then they gave us approval to do so and clean those up. And so there's just the massive amount of garbage that tends to accumulate when you have an uncontained location of people camping is difficult anyway, but it's an amazing problem when you have 1 million plus neighbors.
Thanks, Jill. Appreciate everybody on all of this immediate concern around homelessness. I think it's also important that we address long-term solutions, and I know the city works really hard on that. And Blake, you know, what is the city doing regarding housing and homelessness? What is the city doing to increase affordable housing and access to it?
Thanks for that question, Weston. If you recall, right at the start of this discussion, I mentioned the $65 million that's been put into affordable housing, which has come out more than any other jurisdiction in the state, including the state of Utah. To that point, as far as some of those outcomes, our planning division, which is a part of the Community and Neighborhoods Department, continues to push toward updating our zoning to allow greater housing diversity and density. And we've seen more than 2,500 affordable units under construction or online in recent years, and 448 units constructed in the 2019-2020 fiscal year. So we are doing everything we can to increase our supply and to try to preserve affordability. And I would also like to mention too that in addition to the new units of housing, we want to keep city residents in existing housing and preventing homelessness by obtaining funding to provide residents in need with rental assistance. So the Housing and Neighborhood Development Division, a part of the Community and Neighborhoods Department, over the past year has procured and is putting out into the community more than $8.5 million to keep residents housed. So there's the element of the new construction that we're investing in, but also during such a difficult time during this pandemic with job volatility and economic insecurity, we're wanting to keep those at risk of losing their housing in it. We want to keep them in their housing. Thanks, Weston.
Thanks, Blake. There's a lot of questions that come up, a lot of conversations around tiny homes. Do you know if there are any conversations going on in the city about tiny home projects? And I should point out that that was a question from Dick on Facebook. So if people want to start asking their questions there, we'll pull them into the conversation.
Okay, great. I'm happy to take a stab at that one. Thank you, Dick, on Facebook. So the use of tiny homes is a concept that the mayor has spoken about publicly recently, and I really appreciate her willingness to explore it as an option to provide housing for our residents experiencing homelessness. For any of the folks listening that have read Matthew Desmond's Evicted, we know how important mentally and physically shelter is and housing stability. So from my standpoint, I've been deep in a literature review phase, I'll call it, studying models around the country. I know a lot of attention has been brought to the Community First tiny home community in Texas. And so I've just been doing that due diligence of trying to read, understand how the various models work, and considering the land use and financing barriers that we would need to overcome for this to be a reality. So I appreciate the question, and I want it to be known that it's certainly on my radar and something that I'm studying.
Thanks, Blake. Another question that comes up, and I don't know, maybe Michelle, this might be for you. Can you address the concerns of not enough beds or less beds than before Rio Grande was torn down? So talking about bed availability this year versus last year as our new resource centers and stuff have come online.
Yeah, so we've got a year-over-year bed comparison that is available for people. It is on it's on our Housing and Neighborhood Development website. You can check it out. We have more beds available this year than we had last year, which is fantastic. It's really great to see. We also have more non-congregate. We have way more non-congregate options this year than we have ever had before. And whenever you are going to open up a new facility, it's going to serve a different population. So one of the things that we knew that we wanted to focus on this year was trying to get at some of those couples that Amanda mentioned. We wanted to try to find ways to bring folks into shelter who maybe had not accessed shelter options because that kind of an option that was going to be the right option for them with their partner just wasn't available until now. And so we are really lucky in that we do get to have a sort of more of a variety of beds to serve people in a different capacity than we have had before. That it serves a different population, and it's really helpful to bringing those folks in who maybe otherwise would not have come in. We are pretty close, I will say, actually, with all of our overflow facilities that we've been able to open up this year to the exact same bed capacity that we had before the downtown shelter had closed. So that being said, I think that we actually are kind of in a better place as far as the variety of options that we have for people and the stability that those options can offer to people who are coming in off of the street. Yeah, I think that our homeless resource center system is definitely in transition still. It was very much in transition when we first started it, and then the pandemic hit, and that changed homeless services across the country, really, for people. So we're learning, we're making adjustments, we're making constant adjustments. One thing that we want to be sure that we are absolutely focused on with our homeless services system is getting people out of the homeless services system and very, very quickly into housing. The things that Blake mentioned, all the resources to get people out of shelters and into housing are really the key to keeping homelessness rare and brief and non-recurring, as is our goal.
Thanks, Michelle. Our next question comes from Jessica on Facebook. I don't know, it could go to any of you, I suppose, but maybe Amanda. Have any of these leaders met with our houseless community and asked what they want from the city? What is the city doing to address the root causes of homelessness? And I know all of you interact with our homeless community quite often, but Amanda, if you would like to maybe address that.
Thanks, Weston. So as far as having individuals with experience, right, be in on some of these conversations, I know that the Salt Lake Valley Coalition has really opened its doors and invited anyone, even those who are, have the most experience, right, navigating the system, to participate in some of the decision making in the groups and things that are going on. Additionally, when we started the new system of resource centers, I know that we also had many focus groups, and just within our own agency, we've had focus groups to try to make sure that we are considering the needs of those who we're providing service to and the barriers that they face, and trying to get a clear picture of their experiences, so that we can do our best to ensure that we're making navigating and going through those systems as easy as possible.
Thanks, Amanda. I know that the city values the relationship with Volunteers of America greatly because of that in-person interaction that you continually have with the homeless community, so that we can incorporate a lot of that feedback directly into our processes that we use. And I know the health department is the same, so I appreciate that. Does anyone else have anything to add to that one? Or we can go to our next question. Can you talk about neighborhood safety? How are teams doing outreach all over the city, and how are they finding out about where camps are? What's the process? Michelle, I wonder if you might take that one.
Yeah, I can start that off. Maybe Amanda can jump in too once we describe the part of the city. So we have the Salt Lake City mobile app. That is a reporting mechanism that people can use, and it flags homeless related concerns. Those homeless related concerns come to my team, to the homeless engagement and response team. And what we do is we turn those reports over first to Volunteers of America. First, what we try to do is we try to suss out whether or not the camp is active or abandoned. If it is abandoned, then we can treat it as abandoned debris, and we can go send a cleaning contractor to go and pick that stuff up, which does happen fairly frequently. If a camp is active, what we want to do first is we want to make sure that outreach gets eyes on that camp. So we send that over to Amanda's team. We send it over to a couple of other teams as well, and they coordinate to go out to that encampment and try to engage the folks who are staying there. That all comes through the SLC mobile app. It can also come through calls to the city, to the Housing and Neighborhood Development team, which I am a part of. It can also come through just emailing your different city representatives and letting them know that you are concerned about a camp that you see, and sort of what specific concerning behavior might be surrounding that camp. We always absolutely want to make sure that outreach is the first step to figuring out what to do with the camp.
And just to kind of follow up on what Michelle said, so we obviously get information from the Salt Lake City mobile app, so from our neighbors in the city of areas. And then additionally, we do just a level of outreach on our own, which is driving around or going to places where we believe there may be encampments or individuals experiencing unsheltered homelessness, or where there have been people in the past. And also we get a lot of calls directly from individuals experiencing unsheltered homelessness and meet them wherever they're at. So that also helps to inform kind of where we're seeing people, as well as we get calls from business owners and homeowners all over the county, and just different community-based individuals just calling to say, hey, this is, there appears to be someone in this area. Can you come check it out? And we would respond that way as well.
Weston, this is Dale. If I might also address that very briefly, the health department deals with about, we receive 1,100 on average encampment complaints per year. A small percent of those, maybe 20%, come from our municipality partners, but the vast majority of those come from neighbors, businesses, people that are concerned about the negative impact that an encampment might be having on their business, on their neighborhood, on their resident, those type of things. I think it's important to note too that the health department does not actively go out and try to be proactive in encampments. We get more than enough referrals to deal with what we have the resources to address, but the partnerships with our municipalities is certainly a part of that.
Great, thanks everyone. Our next question is a clarification question, wondering about during abatements, are people's medications, IDs, birth certificates, social security cards, etc. thrown away? How does government and service providers help support individuals who might have lost or misplaced their IDs? And I don't know if Dale, if you want to start with what happens at abatements regarding important documents, and maybe Michelle can follow up.
Yeah, thank you, Weston. Certainly none of that occurs intentionally. We have a locked cabinet here at Environmental Health, where if we come across any legal documents that look like they might be of value that have been abandoned in an encampment, we'll keep those, and we keep those for 6 months. But intentionally, any medications or those type of things, of course, we would not intentionally throw away. And that's something that we would hope would be taking with or addressed by the responsible party when he or she leaves an active encampment.
And then to follow up with that, we actually, as I believe it's the entire state of Utah, are able to provide ID vouchers for free for people who are experiencing homelessness. All they have to do is go to a professional provider and let them know that they need to get their ID. And we will provide a voucher for them to go ahead and do that. That's free of charge. I don't remember exactly how many IDs they can get. I think there's a limit to the number of times that you can re-up that. But it's something that we know trying to sort of wrangle documentation is one of the most difficult things for people in this, for people who are living unsheltered, and we want to make sure that that's not too much of a barrier.
Great, thank you both. Real quick, we had a question on Facebook that referenced the actual shelters and the shelter service providers. And I just want to make sure that we clarify, one group that we may not have in this conversation would be the shelter providers and the state. And I don't know, Michelle, if you wouldn't mind maybe just mentioning who operates the resource centers.
Certainly. So the Gail Miller Resource Center and the Homeless Youth Resource Center are run by Volunteers of America, the Geraldine King Center and the Homeless Youth Resource Center are run by Volunteers of America. The Gail Miller Resource Center and the Men's Resource Center in Salt Lake, as well as the Midvale Family Shelter, are run by the Road Home. There are other providers also. There are domestic violence service providers. There are providers like Family Promise and the Rescue Mission of Salt Lake City. They are also shelter providers, though they tend to have programming that is more on an enrollment basis and not necessarily on like a intake you can just walk in and get in basis. And then we also have overflow facilities that are currently being run by a new provider to our community that is called SwitchPoint. They have been running shelter in St. George for quite some time. And they approached us this year and let us know that they would be happy to be the overflow provider for our community this year, which is great. It's always good to see new providers come into this space. It helps us to innovate. It helps us to provide more options for low barrier service for people. It just kind of, I think, alleviates the pressure on our already very hardworking service provider community.
Great, thank you. Well, it looks like we are just about out of time here, but before we go, we know that many people are wondering about how they can help. So our teams are going to add in the various chat spots where this is broadcasting some links to some agencies and programs that would benefit from both time and donations. And I wondered if anyone else on this call had any call to action or any advice for folks who are wanting to get involved.
Yeah, this is Dale from the health department. The one thing that we would recommend is please don't just drop off food at these locations. It tends to have a lot of problems. Mostly it goes to waste. And so more organized groups such as the Food Bank, Red Cross and others is where we would recommend donations, particularly those that a family would be desirous to donate to this difficult problem.
Thanks. And Weston, I just want to make one more plug for the SLC mobile app. Anybody who is concerned about an encampment, anybody who's concerned about a person experiencing homelessness in their community, something like that, they can enter that information into the SLC mobile app. We always take a service of first approach with that. So if you are concerned about trying to report something via the mobile app, please know that that goes first to services. That's the direction that we want to see this go. Also, just a quick reminder that we have our shelter utilization dashboard that is going live today. That will be great to see. That's a work in progress. As I've mentioned a couple of times, the Homeless Resource Center system is new. We're working on trying to make sure that it works as best as it can for everybody who needs to access it.
Thank you. Anything else from anyone?
You can always check out our website at voaut.org, and you can either volunteer, do in-kind donations, or find a facility to donate items to. That'd be great.
And Weston, with Michelle being a member of my team, I just echo her comments and ask that when our department comes forward with bold policy recommendations for homelessness and housing, that will be able to have the support of the community coming in.
Great. Thanks everybody so much for being here and your time. We appreciate all of the questions and the interest on this important and challenging topic. I hope everyone has a great day. Thanks.